I'm doing a spinal and the patient says, I don't want a spinal. That's it.
Now, having said all this, and Lou, I know you have a question. I'll come to you shortly.
But Dave, even before your question, then it means that when you are going through and you even lie.
Oh, it affects you.
Yes,
It affects you.
It affects you. That's what I wanted to touch on.
That brings us to when we have emergencies.
Exactly.
And we have to do it under like a fasted procedure, or when we have to do cases under fasted procedures.
The accident, the family,
Yes,
the person cannot speak.
Yes, when we have to make sure that this patient hasn't eaten for a particular time, or even electives, when we make sure, and then they tell us, you know, and you start the procedure and the child regurgitates malt or bread. So yes, lying puts your life at risk on the table, and we've had a lot of.
Because that's where I wanted us to touch on. Because there are people who may come in or not disclose all the truth, not necessarily lie, but they'll not tell you all the truth. Yeah. They might not see the ingesting of malt as food, but they don't also know that it can come through the nostrils and even choke the trachea air passage and create problems. You know, I wanted to read medicine, though, but let me this can't to us. Don't mind me. Don't mind me. Yeah.
So, two questions. Who cannot take anesthesia?
Oh, but she's answered that question already. I went to.
She did?
Yeah, she did.
Okay.
Everybody can take anesthesia.
So I'm saying, is there a point where you say this person here, it's not advisable for us to give them at all?
Okay, so if you use the word advisable, yes, there's a point where we say it's not advisable. When we think that when as part of the team discussion, we think that the surgery is not going to be of much benefit compared to the risk of taking you through anesthesia, we would advise you not to do it. But in the end, the onus lies on you. If after all this discussion, you say, okay, I would want to take that 0.1 risk of anesthesia because I think the surgery will be of benefit, we will go in with all the resources that we have to help you.
But is it possible to do surgery without going through anesthesia? Is it possible?
Absolutely not.
No.
So, my second question is around that. So the thing that when you are going to remove your teeth,
they give you some anesthesia.
That's anesthesia.
Yes.
I have received it before. Doctor did problem.
But was it painful?
Well,
after the
panier, then it becomes numb. Somebody punches you in the face, you won't feel anything. But after the procedure, I went home a few hours later. Pain. I want to ask, is there a way that you can administer maybe small doses of that to when the wound heals or something?
So let me add to the question because that's another question I wanted to ask. You don't just manage pain during surgery, but you manage pain even for people with certain conditions. You manage pain for all such persons. So based on what he said, let me just add on to it. What goes into the management of pain in general? What do we need to do? Even not necessarily from experts or professionals like you, but even from our own homes. Now, there are times when you hear, for example, that if you have a headache, just massage, your head ends, the temples, and then you'd have whatever. I'm asking this question because many people at home are quick to abuse antacids, the painkillers. So today paracetamol, Tylenol, today whatever. We are abusing all these things. So I just want to know from you, in terms of managing pain, what do you people do? Not just for surgeries, but even for people who have some small challenges at home. How do you manage
especially
the pain?
when they are anesthetics, as
anesthesia.
Like I'm saying, I don't want it to be just after the anesthesia wearing off, after you've undergone the surgery. But general pains that people are having at home. I fractured my ankle, and then I want to go on painkillers. I did this. Are there ways we can manage these pains, treat these pains without necessarily going for painkillers? Or we always need experts like you to administer them?
It would be best, to get an expert. But I mean, having the first aid knowledge is also important. So I'll just throw in some advice in there. There are pharmacological where you use drugs and non-pharmacological when we are dealing with pain. So if when we talk about acupuncture, when we talk about massage, when we talk about hot water compress, cold water compress, all that is non-pharmacological. It's actually something we believe in. It's part of what we practice. So there's non-pharmacological and there's pharmacological. However, if you were having headache and you haven't hydrated the whole day, it could just be water. So drinking water. So staying hydrated is also very important. There are very little things that we don't look at. You haven't been able to poo for 3 days. That could be the cause of the headache. So there are little things that you need to look at when something has persisted. Something is persisting. But if you realize it's been 3 days, everything is fine, I drink water, I eat fine, I don't feel unwell, but I have this headache, it's best you come so we can.
What if somebody went through, I won't say cesarean under this circumstance, but normal childbirth?
Okay.
And I'm not a female, I've not been through it, so I can't say, but you have that pain. Is there something you can do to manage the pain for you? Non-pharmacological, that is unfair. How do you manage that?
Yes. So they are the ones we even focus mostly on because we really love childbirth and So yes, when it comes to, there's this thing we call like a nerve stimulation thing that we apply that helps. Okay, it uses something we call Gates theory of pain, with lots of fancy words, but it basically means that pain pathways are passing through a particular gate. Okay, we all are passing through a gate. Now, these pathways also come in line with other pathways. So let's say Oba and I are going through this gate. Now, I am the pain. Oba is like a dull kind of sensation, not really pain. So what we do is, since I have decided to be very aggressive through the gate, you will push Oba, and that's where we use the gate theory. So that's where the acupuncture and the massage comes in. So stimulating certain nerves in that same area is known to give some sort of relief. So this time, instead of it being that harsh pain, it's this dull, sweet sensation, same through the gate. So we use that kind of theory, and then massage, hot water bath, them giving the hydrotherapy, having aromatherapy, just having candles in the room actually also helps.
Aside from making it a romantic environment.
It helps with pain.
But David, talking about that, is there insight? And David asked that question about the final say coming from the patient. You've also heard where women are afraid of CS, partly due to there are other things, but partly due to some of these processes and all that. In your experiences, do you come across women who, like, they are torn between it, and sometimes I hear it becomes debatable? They are fighting, the husband has to come and decide for her, sometimes mother has to come and decide for her. And I know women go through, and you made mention of about how you cherish babies being born and all that. How do you think is the best way to navigate it? Should they decide at home before they come to the hospital, or how do they go by it?
Dr. Samuel, take this one.
Yes, so we are culturally different people. The textbooks tell you what to do, but then because of the kind of society we find ourselves in, the kind of people we are, a woman who is coming to have a delivery should make the decisions by herself. She's okay, she's old enough, past 18, legally ripe to make decisions for herself. She would not need her husband, but in the cultural context and the place that we find ourselves, sometimes we give room for the husband's family to come in, probably help her make the decision. But then again, the final decision lies with the woman, not with the spouse or the partner. Yeah, so we advise, we talk to people. Let me quickly add that Anaesthesia is developing and we are growing. We are branching out into very fine subspecialties. We currently have one of the finest anesthesiologists. She's called Dr. Patience Ejapon. She's our obstetric anesthesiologist. So you see, she's just an anesthesiologist for obstetric stuff. She's amazing at her job.
I'm happy you touched on that,
yes.
Dr. Siri, because again, I was going to ask, what advancements are being made in anesthesia care, especially to improve patient safety and comfort. So I'm happy that you're talking about the advancements being made. It's a good area, huh? Yeah. What would you want to say to people who are listening to us right now? All the myths and all the misconceptions that, for example, Eugene was asking, that people have, the fear, the anxiety, the confusion. What would you want to say to people who are listening to us right now about how they should perceive anesthesia?
So I would say anesthesia is fantastic, it's fine, and get an anesthesiologist friend.
Why?
Get one as your friend.
Why?
We are the finest doctors. We are the finest doctors, and we are your last check for safety for any procedure you're going to. So
listen, these guys manage pain. So aside from the issue of sedation, anesthesia, and all that, as you listen to us, if you have any question in relation to what we've talked about so far, call us, get the right answers. They will give it to you. But again, if you are somebody who normally has some kind of a pain, and you abuse painkillers, and you want to have alternatives as to the non-pharmacological way of handling things, why don't you call us on 03220 83596, 03220 83597, and